All right, good afternoon, everybody. Well, hard act to follow. Tim Zorkowski has a lot of experience, and I would say, as a young surgeon, relatively, I think leadership skills are something I'm learning every day. So, thank you for a great talk. It gives us great segue into the technology session today. I think, as you'll see in this talk, still a lot to learn, a lot of disruptive technology coming out there. I think there's still a lot to learn about what it provides to us and what we can learn for the future. So we'll talk about patient monitoring strategies today. We'll talk about what we have today, but really where we're going. So I have some disclosures, but the most relevant is that I have a PhD in biomechanics and gait analysis, so the topic's near and dear to my heart. So let's talk about remote monitoring. So there's been a lot of news articles on this. I remember reading this 6-7 years ago. Every patient's going to have an Apple Watch. It's going to tell us all the exciting data. It's going to tell us what we need to do for our patients. And then one in 2018, one in 2020, and now 2022. There's a lot of physician enthusiasm for remote monitoring. I guess our hope is that we see our patients once for pre-op and then I guess never again. But the reality is that we still don't really know what remote monitoring gives our patients. In terms of digital health, telehealth has become extremely common, especially with COVID. At least in my practice, many patients have virtual follow-ups with me, so that's been a huge benefit to my practice, and I'm sure to many people here in the room. Remote monitoring, however, this is a digital health solution that captures patient data outside the traditional healthcare environment. So this is any patient data that you get outside of the office or OR potentially. So this is pretty pervasive outside of orthopedics. There's been many studies on blood pressure management, diabetes management, cardiac monitoring. Results have been positive on the whole, showing that we're able to improve patient outcomes outside of orthopedics. But some review articles have shown that we're maybe not there yet and that it may not be that helpful as much as we think. And so there's been a lot of articles of whether patient monitoring is overdue or overused. And I would argue that hopefully we'll have eventually much more better patient monitoring outcomes for the future, which we'll go through. But there's serious revenue opportunity, and I think this is kind of that question. I've never heard that before, Tim, but that's a good one. Well, the money's the answer. What's the question? So there is real revenue opportunity in remote monitoring. This potentially is very effective and very important, especially as we move into ASCs and other opportunities for surgeons. But there are Medicare codes for remote monitoring. I think these are still very hard to actually implement in practice, and we haven't done these effectively at our institution yet. But this is really why we're here and talking about it. So let's talk about joint replacement. There's a lot of different options, okay? These are standard wearables. I'm wearing my Whoop today. It's telling me how I slept terribly last night. I don't know if that's important or not. We have our Apple Watches. We have our Fitbits. These are giving us data such as step length, gait velocity, heart rate, sleep activity, sleep level, fatigue. Then you have range of motion options. So these are kind of points that you put on the body. Right now, they're mostly on the lower extremity, measuring range of motion, but potentially we can eventually have them more at the back and see hip, spine motion potentially after surgery. So getting not only the step length, gait velocity, but also knee range of motion, eventually hip range of motion. So several studies have been done looking at patient engagement. It looks like patients are actually very excited for this. They want to be involved in decision making. They want virtual engagement. 90% were interested in remote monitoring. This was greater in women and younger patients. I don't know if that's important, but something that we found. But I would say the vast majority are actually pretty hesitant about surgically implanted data collection devices, so something to keep in mind and one we'll come back to. So 94% of patients were receptive to wearing sensors, and they wanted to know about their body movement, their balance, their sleep, their cardiac output. Let's talk about wearables. So wearables, we talked about the Fitbit or whatever option it is to measure step length or gait velocity. So at our institution, we looked at this after surgery for both hip and knee replacement, and we found that basically these devices allow us to measure step count. We all know how our patients are very excited to report to us what their step count is, and I still have difficulty understanding what's good and what's bad. But higher preoperative steps is correlated with faster recovery, and this only has a modest correlation with patient-reported outcomes, so maybe not there yet. After hip replacement, another study found that increase in steps per day were associated with better outcomes over time. This was higher in younger patients in anterior approach surgery, early after surgery, and higher in patients discharged home. But there have been studies showing significant inaccuracies depending on where these devices are placed, at the ankle, at the wrist, at the lower back. Really, the data, it's garbage in and garbage out depending on where it is in the body. A review article on hip and knee replacement patients found that the technology is feasible, but there's still unclear evidence to support efficacy. There's been one randomized trial, it's hard to give this talk without mentioning it, looking at remote patient monitoring for patients after hip and knee replacement. They were powered to look at discharge location, which I'm not sure if that's that important if you're looking for monitoring after discharge, but they did find a significant reduction in rehospitalization, which is very important. So I would argue that there is some importance to this. Smart braces, this captures range of motion of the knee currently, but potentially in the future could look at range of motion of the hip. And these can also account for step count, range of motion, and other options like that. In terms of smart implants, so there's really one right now in the arthroplasty market for knees. So this is an implantable device that goes in a knee replacement, gives us our step count, cadence, stride length. Not really sure about range of motion. I think questionable as to how kind of accurate that is. But beware, I'm sure this will come to the hip replacement space soon at some point. So it's something to keep your eyes on. It's something that may come up in the future. If you're looking to look at remote monitoring in your practice, I would look at the AMA guidelines. These have a very nice handbook on how to implement these. In terms of what matters, so I would argue there's a lot more that matters in terms of just step count and gait velocity. Okay, I've done a lot of gait analysis on kinematic parameters, kinetic parameters, moments around the hip, and these are vastly more important for function after surgery. But still, studies have shown time after time that even in hip replacement patients, 1 year after surgery, patients who feel like they're doing great, their gait outcomes are still different than normal patients of their same age. So we're still not there yet in terms of assessing what our outcomes should be. So studies measuring functional activities are lacking. Our patients are doing a lot more than just walking around their house, okay? And we still do not have a good grasp of how active our patients are in terms of what matters to them, and each patient is different. Motion analysis labs, this is the one at HSS, very high level, very exciting, but patients don't have this at home, so we can't really measure those functions at home. It's not ideal for the office or remote monitoring. So our goals, this is in our office, so we have steps and we have a gait mat, and we try to measure our patients both before and after surgery, looking at their hip and knee range of motion, both before and after surgery, get a gauge for what their activity level is, and then eventually implement this on an outpatient basis. This is looking at sitting, standing, and we're able to monitor their motion doing a variety amount of activities. And so our overarching goal is to understand functional motion parameters for patient-specific success and develop an improved remote monitoring capability. So in conclusion, I think there are many technologies that are very exciting and lots of data out there. I think right now these only scratch the surface of really understanding what each patient expects and what an outcome that is successful for each patient means. So again, the clinical utility is still being investigated. Additional work is needed, and I'm excited to pursue that. What data can be remeasured accurately, remotely, what data implies for patient-specific function after surgery, and how does it correlate with satisfaction? Thank you.